How do sickle cells affect your RBCs? Imagine your blood cells as tiny, flexible discs that glide smoothly through your blood vessels, delivering oxygen to every part of your body. In sickle cell disease, these cells change shape into a crescent or C shape because of a mutation in the hemoglobin gene. This mutation produces abnormal hemoglobin called hemoglobin S. When oxygen levels drop, hemoglobin S molecules stick together, forming long, stiff rods that distort the red blood cells into their sickle shape. These misshapen cells are much less flexible than normal cells. Because of their rigidity, sickle cells tend to stick together and block small blood vessels, which can slow or stop blood flow. This blockage prevents oxygen from reaching tissues and organs, leading to episodes of pain called vaso-occlusive crises and potential organ damage over time. Normal red blood cells are designed to be flexible and disc-shaped, allowing them to squeeze through tiny blood vessels easily. Sickle cells, however, are stiff and sticky, making it difficult for them to pass through these small vessels. This causes blockages that can result in tissue ischemia, or lack of oxygen, which can damage organs like the spleen, liver, kidneys, lungs, and even the eyes. Because sickle cells are less flexible, they tend to get trapped in the spleen, causing it to enlarge and sometimes impair its ability to fight infections. Another major effect of sickle cells is their shortened lifespan. Healthy red blood cells usually live about 120 days, but sickle cells only last about 10 to 20 days because they are fragile and break apart easily. This rapid destruction leads to a shortage of red blood cells, a condition known as anemia. Anemia causes symptoms like fatigue, weakness, and shortness of breath because your body isn't getting enough oxygen. The constant breakdown of sickle cells also releases bilirubin, which can lead to the formation of gallstones. The presence of sickle cells in the blood promotes inflammation and oxidative stress, which further damages blood vessels. This ongoing damage can cause swelling, ulcers, and other complications such as priapism, which is a painful, prolonged erection. The increased stickiness of sickle cells and the inflammation they cause can also raise the risk of blood clots. Over time, repeated blockages and low oxygen levels can harm multiple organs, making sickle cell disease a serious, lifelong condition that requires careful medical management. In summary, sickle cells change the shape and flexibility of your red blood cells, drastically reducing their lifespan and causing anemia. Their stickiness and rigidity block blood flow, leading to pain, organ damage, and increased risk of infections. Understanding these effects helps explain why sickle cell disease can be so challenging and highlights the importance of ongoing medical care. If you or someone you know has sickle cell disease, always consult healthcare professionals for personalized advice and treatment options based on individual health needs.